Red cheeks, red nose, red forehead, red chin, red eyes. 80% of rosacea patients have ocular rosacea. Most don't even know they have it. Even more don't even know that ocular rosacea exists. Let me tell you all about that. So one of the most common systemic conditions that I see is rosacea. And believe it or not, 80% of rosacea patients have ocular rosacea. Now, ocular rosacea leads to dry eye. So you'd think that these rosacea patients are coming to my office because they have dry eye, but unfortunately, this is not the case. The reason for that is most rosacea patients don't even know that ocular rosacea exists. So I want to do a brief overview of what rosacea is, the triggers, the signs and symptoms I look for, and one bonus treatment that is new to eye care that's helping treat these ocular rosacea patients. So what is rosacea? Basically, it's an inflammatory condition of the skin. It affects the chin, cheeks, forehead, and nose, and it causes redness and abnormal blood vessel growth. When this abnormal blood vessel growth gets to the eyelid margins, it causes inflammation. This inflammation causes ocular rosacea. So some common triggers that make the rosacea flare up. So if you have rosacea, you know that you have good days and bad days, and these flare-ups are caused by a variety of things. They include emotional stress, spicy food and alcohol, bacteria buildup on the lids, lashes, and the face, as well as UV exposure and heat exposure. So if you're outside in the sun, if you're going skiing, UV can cause a rosacea flare-up. So make sure you have good sunscreen and watch out for those triggers, because if you know what the trigger is, you avoid it, you're going to stop your rosacea flare-ups. So when a patient comes into my office, I'm always doing a thorough case history. So I'm looking for Accutane, doxycycline, any retinoid creams. These are things that dermatologists will prescribe to rosacea patients to help treat them. So I'm looking for that in the case history. I'm taking a brief overview of their face, their cheeks, chin, nose, and if I see any signs of abnormal blood vessel growth or redness, I'm thinking rosacea. But a lot of rosacea patients use a lot of makeup, concealers, so it's not always visible. So I look for the signs and symptoms, and these include burning eyes, red, irritated, dry eyes, light sensitivity. When I start hearing those things, it kind of cues me to make sure I'm looking for signs of ocular rosacea in the slit lamp. So when I do the exam, things that I pretty much always see is a lot of debris in the lids and lashes, inflamed eyelid margins, and those telangiectasias or abnormal blood vessel growth that's creeping up into the eyelids. Now, the reason why there's a lot of debris in the lids and lashes is rosacea patients have the epithelial layer of their skin shed a little more quickly, so this causes the added buildup. This added buildup will cause inflammation in addition to the abnormal blood vessel growth, and it's a cascading of events that leads to ocular rosacea and dry eye. So one of the newest treatments to eye care is intense pulse light therapy, or IPL. This was used in dermatology clinics to treat the redness of the cheeks, forehead, nose, and chin, but we're now using it to treat dry eye and ocular rosacea. This is amazing because it removes the bacteria that's causing inflammation. It gets rid of those abnormal blood vessels, so it makes the aesthetics look nicer, but it also removes the source of the inflammation, and it gets the meibomian glands, the glands of the lid, to function normally and restore normal activity. So going forward, what I want you to do is make sure that you find a doctor that knows what they're doing with ocular rosacea. Don't just accept your symptoms. If they have an IPL, that's a bonus, but making sure the eye doctor knows that it exists, you're talking to them about it, this is going to make you not have to live with the signs, symptoms, and irritation that rosacea can manifest in your eyes.